You're listening to Med School Radio. Welcome back to Med School Radio. This is your no-frills version of looking at summaries of QBanks. So let's go for it. Some of them you've heard before and some of them will be new, so let's start off. Okay, we've talked about the ureters before. Remember that the ureters pass posterior to the ovarian or gonadal vessels within the retroperitoneum and cross anterior to the common or external iliac arteries to reach the true pelvis. Within the true pelvis, the ureters lie anterior to the internal iliac artery and posterior to the uterine artery. Direct inguinal hernias occur most commonly in older men due to weakness of the transversalis fascia. They protrude medial to the inferior epigastric vessels into the Hesselbach triangle and pass only through the superficial inguinal ring with no direct route to the scrotum. That is direct inguinal hernias. Okay, next let's talk about carpal tunnel syndrome. Remember that this occurs due to compression and or inflammation of the median nerve in the carpal tunnel and typically results in sensory loss over the palm and anterior aspect of the first 3.5 digits with the thenar atrophy and impairment of thumb flexion or opposition. In the forearm, the median nerve courses between the humeral and ulnar heads of the pronator teres muscle and between the flexor digitorum superficialis and flexor digitorum profundus muscles. Dysenergic defecation. Dysenergic defecation occurs when the puborectalis muscle or the internal or external anal sphincter fails to relax during defecation, leading to chronic constipation. Dysenergic defecation is usually considered a functional disorder and occurs more commonly in the elderly, but may also occur with certain neurologic disorders, for example, Parkinson's disease, multiple sclerosis, or trauma. And moving on, let's talk about the vagus nerve. Remember that the vagus nerve provides cutaneous sensation to the posterior external auditory canal via its small auricular branch. Sensation to the rest of the canal is from the mandibular division of the trigeminal nerve. We've talked about that before also. Okay, moving on. Okay, let's talk about gravity. Due to gravity, supine patients typically aspirate into the posterior segments of the upper lobes and superior segments of the lower lobes. Patients who are upright tend to aspirate into the basilar segments of the lower lobes. Aspirated material is more likely to travel down the right main bronchus. Let's talk about the anterior cerebral artery, or ACA. The ACA supplies the medial aspects of the frontal and parietal lobes, which contain the upper motor neurons responsible for contralateral lower extremity motor control. Thromboembolic occlusion of the ACA characteristically results in contralateral lower extremity weakness with hyperreflexia. One more time. Thromboembolic occlusion of the ACA characteristically results in contralateral lower extremity weakness with hyperreflexia. The lateral pterygoid muscles are the only muscles of mastication that aid in depressing the mandible, i.e. opening the jaw. Spasm of the lateral pterygoids prevents spontaneous reduction of the anterior dislocation of the temporomandibular joint. And moving on, infarcts involving the anterior portion of the medial pons can produce dysarthria and contralateral hemiparesis or lower facial palsy due to disruption of the ipsilateral, corticospinal, and corticobulbar tracts. The trigeminal nerve arises at the level of the middle cerebellar peduncle at the lateral aspect of the mid-pons. The Valsalva maneuver increases vagal tone and can be used to abolish paroxysmal supraventricular tachycardia. The rectus abdominis is the most important muscle in achieving the increased intra-abdominal and intrathoracic pressure of the Valsalva maneuver. The left ventricle forms the apex of the heart and can reach as far as the fifth intercostal space at the left midclavicular line, or MCL. All other chambers of the heart lie medial to the left MCL. The lungs overlap much of the anterior surface of the heart. The hindgut encompasses the distal 1/3 of the transverse colon, the descending colon, the sigmoid colon, and the rectum. These structures receive their main arterial blood supply from the inferior mesenteric artery. Damage to the left temporal hemiretina will disrupt the transmission of visual information along the ipsilateral optic nerve, lateral optic chiasm, optic tract, lateral geniculate body, optic radiations, and primary visual cortex.